Hi, it's Dr. David Greene, CEO of R3 Stem Cell. The topic today is, are there ethical considerations with amniotic stem cell fluid? So in the history of stem cell treatments, there have been some ethical considerations with aborted fetuses and embryonic stem cells. Now, neither of those are applicable to amniotic fluid, and I'm going to tell you why. Amniotic fluid has a lot of beneficial properties for the baby that it surrounds. It helps to prevent infection, it helps to provide nutrition, it helps to help the baby grow. It just does a lot of things. So typically when a baby is born, either through C-section or normal birth, vaginal delivery, the placenta and the amniotic fluid are discarded. But what we've seen is that with all the beneficial components of it, it's starting to be used for lots of things. So the way that amniotic fluid is obtained for regenerative medicine is after a scheduled C-section. The woman is consented, the hospital is consented, they have a contract, and basically what happens is the baby is born through the scheduled C-section, the baby's fine, and then the amniotic fluid and the placenta, rather than being discarded, it's sterilely harvested and taken to an FDA-regulated lab. Okay? So you don't have the issue with aborted fetuses. It doesn't use an amniocentesis. It's after the baby's born and fine that the material is harvested. And it's not taken in the middle of the night. Nobody knows about it. You know, everybody knows about it. The hospital is contracted. The woman is consented. So everything's above board, and it's an FDA-regulated lab. So it goes through the same processes as a tissue bank. In fact, the labs that we work with are accredited by the American Association of Tissue Banks. Now, the second thing that is not an ethical concern with amniotic fluid is embryonic stem cells. Embryonic stem cells are ones that have come from aborted fetuses, okay? Now, the thing about embryonic stem cells that's good is that they were able to differentiate into any of the cell types of the human body. The problem is they didn't know when to stop a lot of the times. So you could end up getting a tumor in the area that you're trying to help. All right. So the good thing with amniotic stem cells is that they're not embryonic. They're what's called pluripotent. So yes, they can differentiate into a lot of the cells of the human body, but they do know when to stop. They have an off switch, so to speak. Okay. So what I'm getting at is that there are no ethical concerns with using amniotic fluid for regenerative medicine. Visit us online today at r3stemcell.com. There's a lot of educational information on there. There's a physician locator so you can get treatment near you. And call us at 844-GET-STEM. We'll answer your questions and get you hooked in for treatment. Thank you for watching.